Hey, we are live and we are just working through a few things and the show will begin. But in the meantime, let's keep on watching our loop and hopefully other people are able to join. If you are watching us, just make sure you click the share button, share the video to others so that more people will join and we will have a fruitful and a very educative discussion. So while we work on some of the technical things to begin, I just want you to hit that share or like button right now. Yes, I'm waiting for you to hit that share button. Yes, if you are joined, please share right now. I'm waiting for you to hit that share button as we get ready to begin our discussion on erectile dysfunction, how to prevent erectile dysfunction, and the kinds of foods that we should eat or you should eat so that your males will continue to be stronger in the bedroom. So as we work through a few technical things, I want you to do that while we watch one of our countdowns.
Do you suffer from erectile dysfunction or do your partner suffer? Stay tuned as today we are going to be discussing this very important topic. Here with me in the studio, I have Dr. Asamoah Oteng, a clinical pharmacist who has been practicing for the past over 15 years now, counting. Dr. Oteng is really passionate about health. Based on that, he has have 2 YouTube channels, one in English, Dayspring Life and Health channel, and then one in also the Ghanaian language, again, is the Janek Ghana Apomodane YouTube channel. I'm going to put all the links underneath the video so that you could check it out. If you don't understand the English, he have in Ghanaian language to help. And I'll say welcome to Ezra Wellness.
Thank you so much for having me.
Alrighty. Is there anything that I missed out in the intro?
No, you said everything.
I called you here because I wanted us to talk about this very important topic, ED or erectile dysfunction. Before, it was like in men who are older that normally experience this. But right now, when you read more articles, even younger people as young as in their 20s, 30s are starting to experience this condition. So I thought that it was necessary that we discussed it. So then what is ED in the first place when we're talking about
ED is a short for erectile dysfunction, as you said, and it's also the same disease state that we used to refer to as impotence. Some people still call it as impotence. And according to the American Urological Association, ED is the inability to achieve or obtain erection and also maintain that erection for successful sexual intercourse.
Okay. So with that said, from the definition, does that mean there is less, like a spectrum that people could go from different stages all the way to impotence, or how would you say?
There's really not a spectrum. As long as there's not the ability to achieve erection, you have ED. And maybe the only reason why you may call it as a spectrum is if somebody is able to achieve erection upon, prolonged stimulation, and also the erection not being strong enough. But ED is ED. As long as you cannot obtain erection strong enough to have a successful sexual intercourse, you have ED, however way you describe it.
So that is, you're not able to keep it till you have sex. That's what. So then what are the causes of this condition, since now it's very, very prevalent among even younger men?
Right. Like you alluded to, hitherto recently, before it was just a disease of older men.
Yes.
But now, because of the fact that other diseases of older men have become diseases of younger men, okay, ED has also caught up with young people. And that is because some of the causes that we used to see in older men are now in younger men. And I call the causes in a very huge or large groups, and then we can talk about the individual examples. So okay, I will talk about one group called the psychological cause. And for psychological causes, we're talking about something to do with your mental health, whether depression, anxiety, or anything of the sort, like stress, leading to usually for that cause, temporal inability to achieve erection. And then also from that, we move on to hormonal cause. The hormonal cause is the existence of low testosterone levels. Testosterone is a hormone that is required for successful sexual intercourse in men. And if your levels are very low, that can lead to erectile dysfunction. So that's another huge cause. The other huge cause is medication use, which comes with some of the disease states that we try to treat with medications. There's also neurological causes, basically on causes that are from your nerves, again linked to some disease states that are occurring in the nerves. And then also there's a vascular cause. The vascular cause, I think, is the most common cause of ED, which basically comprises of the blood flow issues that we have. So your arteries and your veins are compromised, and for that reason, blood flow to the penis is not enhanced, and that also causes ED. There are other causes also that we can also talk about, like alcohol use and illicit drug use. So if somebody is doing cocaine, if somebody is chronically alcoholic, if somebody is using amphetamines or any of those banned drugs, they are obviously going to end up having erectile dysfunction. And this is one of the reasons why younger people are also getting the cause. And apart from that, we can go to the individual examples of some specific causes. So these are the groups of causes that I enumerated. But we can talk about, for example, if we talk about the vascular cause. Okay. For that, you have people with diabetes being the ones that are most often affected. People with diabetes, as well as people with heart diseases. If you have heart disease or any issues with your cardiovascular system, that can lead to ED, because most of the heart diseases are also accompanied with plaque formation, high cholesterol levels leading to plaque buildup in your veins, in your arteries. And for that reason, your arteries become narrowed. And once they're narrowed, they stop blood, or they prevent huge blood flow to your penis, which you need for erection to happen. So heart disease as a vascular cause. And when we also talk about diabetes, apart from the fact that diabetes all leads to plaque formation and narrowing of the arteries, diabetes in itself is also a risk factor for endothelial dysfunction. So the lining of your arteries, where you produce what we call nitric oxide, a substance that is required for dilation of your blood vessels. Your blood vessels become wider when nitric oxide is produced. And when that endothelial system is compromised, when your blood vessels are compromised because of diabetes, then you cannot produce the nitric oxide as much. And as a result of that, you cannot get dilation. You cannot get enough blood flow to your penis and the other parts of the body. So those are some of the specific causes related to the vascular cause. There's also, I mentioned high cholesterol. There's also obesity or being overweight, prolonged overweight. I don't know how to say prolonged obesity. If you are obese for a long time,
for so many years.
Exactly. Being obese, yes, that's the right way to say it. Being obese for so many years. I mean, being obese for a short time is even not helpful, but at least if you can get it down, that's where we want to be. So being obese for so many years can lead to erectile dysfunction. And other things like tobacco use, smoking, can also lead to erectile dysfunction. And smoking is linked to, again, plaque formation in your arteries and narrowing of your blood vessels. So that also leads to the vascular cause where you have erectile dysfunction. So younger people who have been smoking may have this problem. And also I mentioned alcoholism and low testosterone, obviously, and sleep disorders have been also known to cause erectile dysfunction, and obviously depression and anxiety.
Wow, the list goes on and on and on and on and on. There's so many causes here. So now, Dr. Ting, now that we know the causes, what would you say some of the things that we could do to remedy the causes? Because I know specifically, of course, when let's say it's come to testosterone levels. So if you could go in like that, like specifically what we could do to help.
Okay, thank you. Yeah, so to be able to mitigate the causes and the risk factors for erectile dysfunction or impotence, some of the things that we mentioned can be prevented. For example, if you are diabetic, you have to stick to improving your blood sugar levels. You know, I was listening to another doctor that was saying that most of the time when we tell diabetics that if you don't watch out, you're going to go blind, you can get your legs amputated. You don't tell the men that you're also going to become impotent. And then they found out down the line, they are like, why didn't you tell me? If you had told me that I was going to be impotent, I would have taken care of my blood sugar levels.
Okay.
Right now, so that would have been a higher motivating factor for controlling blood sugar, but most people don't say it until it's too late. So if you are diabetic, one of the major things to do to protect you as a man and your manhood is to keep your blood sugar levels under control. So that is one. The other thing is because erectile dysfunction is mostly a vascular disease, you want to make sure that you are preventing high cholesterol buildup by eating the right kind of foods, the plant-based diet, and also exercising to ensure that you have optimum blood flow, you have optimal nutrients that you can draw on to make your testosterone and also, your nitric oxides and stuff that you need to be sexually active and strong in sex. And another thing is to also lose weight to ensure you have optimal weight. We can't say this much any more than we can say obesity and being overweight is linked to several disease states. But for men, especially as we're talking about erectile dysfunction, you make sure that you keep your weight in check. And then lastly, make sure that you are physically active, exercise, routine. Not just when we talk about physical activity, people think that, I wake up at my job, I work all the time. No, that's not physical activity we're talking about. We're talking about intentional activity, setting a time apart to exercise, maybe 45 minutes a day or 30 minutes a day, or even if not every day, 3 times a week, something that you sweat, doing something intentional. That is what I mean by physical activity. Doing all those things will help prevent erectile dysfunction.
Great. Well, viewers, these are things that we could prevent, especially high cholesterol, diabetes. These are things that diet could fix. And that is what we've been talking about. So men out there who are listening to us, if not for any reason to avoid erectile dysfunction and problems in the bedroom, please lower your blood glucose, lose weight, and bring the cholesterol levels down. Dr. Otin, foods that you would say that would specifically, you wanted to say something before?
Yeah, before we go there, I also want to add, especially because in our population, we have a lot of people with high blood pressure, and that is also another cause. So since you are telling men to reduce their blood sugar levels, to check their cholesterol levels, I want to add that let's watch out for our blood pressure too. A lot of men, especially younger men these days, 30s, 20s, 40s, 50s, are getting high blood pressure. Hypertension is a major cause. And I'll also throw in that there's also another cause that I didn't say, injury to the penis. If you have any injury that could cause scar tissue buildup, that can also lead to erectile dysfunction. And if you have had a prostate surgery, some people, because of complications of the surgery, they may have had a damage to their nerves. And the penis is innervated through the prostate also. And once those nerves are cut due to surgery, you could also end up with that. But definitely lower your blood pressure. Yes, you can go ahead now.
Good. Because you see, sometimes to people, the thing is, ED is the first sign that you have high blood pressure. People who think they don't even have high blood pressure or they have not been diagnosed yet, most of the time. So I know when people come to you, that's one of the questions that they will ask you. If you have ED and you're worried about that side, the question is, do you have high blood pressure? And sometimes they don't even know they have it, but the ED is what is pointing to them having the high blood pressure. So with that, Dr. Otin, what are some foods that you recommend for sexual health, especially in men? As we are talking about this ED, we are not saying go out there and eat just this food. This food is in addition to overall healthy diet.
Right. That's a good question. And I also want to add, the point you just made is very important.
Yeah.
There was a doctor that I also saw, I think one of the videos I watched, he actually made a very profound statement, and I really liked it. He said that we always say that the way to a man's heart is through the stomach or through the belly, if you want to right. But when ED disease state, he said that the way to a man's heart, in other words, if you want to attack the heart, or if you want to see that a man is going to have a heart attack, then you go through the penis.
Oh, wow.
And that is profound, because that's exactly what you said. That means that for anybody that sees erectile dysfunction, it's a prelude to major cardiovascular events, whether a stroke or a heart attack, because the blood vessels in the penis are very small. So any small change in your blood, in your body, will show up in the penis as erectile dysfunction. When your heart has not just seen it yet, but eventually, if you don't stop, it's going to go to your heart or your brain. You're going to get a stroke or heart attack or any of that. So that's a very good point you threw in there.
Yeah.
Now, going to the foods that will help with erectile dysfunction. When I did my research, I saw a lot of foods that are mentioned. I try to make sure that the ones that are repeated on several places are the ones that I choose.
Yeah.
And so we're going to go through maybe about 12 of them if we have time.
Okay.
The first one is coffee. And I'm not really a big fan of coffee, but
me neither.
Recently, I'm trying to start drinking a little bit at a time. The caveat is if you have problems with your kidneys, coffee may not be a good thing for you. Yeah. So apart from that, coffee, according to studies, 2 to 3 cups of coffee a day boost a man's erectile function through the action of making the blood vessels relax so that blood flow can go into the penis. So the first one is coffee. In the interest of time, I'll run through a little bit so that if you have any questions on anyone, we can go back. The next one is dark chocolate. Dark chocolate seems to be another one. It's we could call it an aphrodisiac, right?
Yeah.
So since we don't want to get high blood sugar or anything, if you want to eat your dark chocolate, just ensure it's non-sugar one.
Yeah, I always say, Dr. Otin, to that, I always say 72% cacao or higher, so that there is low sugar in it.
Great, 72%
or higher.
Or good, thank you. All right, and the next one is oatmeal. Now the coffee The dark chocolate has flavonols, which is important for those things. Now, oatmeal also helps. I will also call that also an aphrodisiac, right? Oatmeal also has L-arginine. That's a substance that is used in the synthesis of nitric oxide, which in turn helps, to relax the blood vessels and let blood flow in there, right? So oatmeal is one thing that also helps. The other thing is we'll go to a group of foods that I call the nuts, right? Several nuts would help, but these specific nuts I saw that I think will help men. The first one is pistachios. I don't know if it's a nut, but I group it under pistachios. Now you can't tell what something is a fruit or a vegetable, but yeah, pistachios, right? Pistachios also have a lot of L-arginine as well as walnuts. So walnuts, pistachios, they have a lot of the L-arginines that are needed for nitric oxide synthesis. And then we also can talk about almonds. Almonds are also a great source of vitamin E and HDL and folate, as well as all the other nuts that you can eat. But this group of nuts, and for those men who are from Africa, we all know about tiger nuts, right? You can buy tiger nuts on eBay or on Amazon or wherever. We call it a tadri or something like that, right?
Yeah.
All right. The next one is the fruits. So we're leaving the nuts, we're going to the fruits. For fruits, we know about watermelon. It's a common thing that most people know. Watermelon also has citrulline, which also enhances the production of nitric oxide, as well as lycopene, which is an antioxidant, also helpful with your prostate health. And also we also have apples. Apples also is a flavonoid, as well as blueberries and oranges. So apples, blueberries, and oranges are flavonoids that also produce substances that help with your erectile function. Now, let's move on to the next one. I'll call garlic. I'm not so much a fan of garlic. That's because it seems to be used for everything. People will come to me and ask me, I have high blood pressure, where's your garlic? But your pressure is too high that garlic cannot, bring it down. So I always frown on garlic. But if you include garlic in your diet, it is fine. It's not going to bring down your numbers in one shot or anything. It's just going to help. And in ED, using garlic has been known to also help, just because it stabilizes, your cardiovascular system, blood pressure.
But the thing is, garlic has also been known to be a blood thinner. That is why people also kind of use it a lot. But the thing is, you have to make sure that you don't cook it too much. If you could eat it fresh, it's even better. So depending on how you add it to the meal. But like you said, if your blood pressure is too high, just don't depend on garlic alone. Talk to your doctor. Yeah. Exactly.
All right. And the next one is the hot chili peppers or hot peppers. Now, if you like, something, habaneros, all those hot chilies, yes, have also been known to boost testosterone, erectile function. Oh. And the way they do that, I found out the way they do that is while it burns your mouth when you eat it, in the night when you go near your wife, it helps. There's a substance called capsaicin in there that apparently capsaicin helps stimulate the pleasure centers in your brain. Oh, wow. So that you enjoy sex more. So that's for hot chilies, peppers. The other one is fish. When we go to the fishes, I'm going to talk about shellfish and oysters for that matter. Oysters have also been known to have substances that are helpful in the synthesis of testosterone. So if your testosterone levels are low, maybe eating well-cooked oysters may help you produce more testosterone. And then still on the fishes, we have salmons or any of those huge or large fish groups, mackerel, as well as tuna. Those big fish groups also contain a lot of omega-3 fatty acids, and those also help in blood vessel relaxation and also substances that help produce testosterone for you to be able to have a good erection. With shellfish, for example, they also produce zinc, and zinc is also important in a sexual performance cycle. Now, the next food group is what I call the greens. The greens, we talk about vegetables, right, all the time for diabetics and stuff.
Yeah.
Now, if you specifically, we can go to kale. Kale has also been known to boost your nitric oxide levels. Kale. And apart from kale, there's another green called the spinach. Spinach is also known to have a lot of nutrients, a lot of vitamins, and in particular, it's high in nitric oxide levels and magnesium, all of which are important. There's also folic acid also is high in spinach. So now let's move on. The next one I'll have here is extra virgin olive oil. I mean, in my research, it says olive oil, but extra virgin olive oil is better, right?
Definitely.
And that is also known to help in the synthesis of your cholesterol, your good cholesterol, which happens to be the backbone of most of the hormones, sexual hormones like testosterone. So if you have to eat oils that help you, then extra virgin olive oil will be the ones to go. So those help in male testosterone production. And I think that would be, there's a few others that don't necessarily help with erection, but, you know, we talk about fertility some other time. We could also talk about those. Yes.
Definitely. This is a long and extensive list of foods. And even if you say you're going to eat within this food group, you'll get a lot to eat. So the men out there, please make sure you're incorporating some of this healthy food in your diet. What I would say about the oatmeal is that make sure it's steel cut organic so that you don't get a lot of glyphosate in your bloodstream, and that also will cause a lot of issues for you. So, and
that's a very good point you brought up. It's saying that any of the food groups that we have mentioned, stay away from processed ones, even if it's fish. Don't get canned fish. I mean, you are losing the whole thing. So everything has to be, as much as possible, natural state. Yeah.
Okay, Dr. Yasin, we are bringing our conversation to a close. As a pharmacist, I just want to ask that there's some supplements that someone is eating healthy, but they want to add it in there so that at least, you know, it will boost things up a little bit.
Yes, there are a few supplements that I would recommend, but then again, still have involve your provider or your physician in any choice you make. Definitely. Because some of these can interact with your regular medications. When it comes to vitamins, dietary supplements, that's the most important thing, interaction with other medications or even other disease states. So with that statement out of the way, I'm going to bring out three of them, and then we will talk about them. The first one is what we call DHEA, which is dihydroepi. I make a hope you.
No problem.
Yes. Dihydro. Okay, let's start from that point.
DHEA, You want to start from
DHEA, which is dihydroepiandrosterone. Okay. This chemical is used in the body to produce more testosterone. It increases a woman's libido. And in men, it helps with erectile function. And though it has been studied a little bit, it is known to be safe, and the only thing is, as a side effect, it causes acne. So if you use it and you have acne, that will be the reason why. The other thing is another substance that I actually alluded to earlier called L-arginine, which is an amino acid. The L-arginine also helps boost your nitric oxide levels because it is in the pathway of nitric oxide synthesis. And when you took those supplements, you basically are able to dilate your blood vessels in your penis to allow blood to flow in there. So that is another supplement that you could also use as a man. But then again, it also has a few side effects such as nausea, cramps, and sometimes diarrhea. And the caveat, the thing with this is don't ever use this L-arginine if you are taking any of the PD5 inhibitors, which is either a Viagra or Cialis. If you are taking any of those, please don't take L-arginine because of serious risk of interaction. And the last one is ginseng. Ginseng is also shown to help improve sexual function. and actually improve erectile function. There's also a cream made out of ginseng that is used for premature ejaculation. But for ginseng, it works on a short-term basis. You cannot dwell on ginseng for a long time. So if the man out there who stops at your gas station or your pharmacy to buy stuff, just watch out. You can dwell on ginseng for a long time. The side effect with ginseng is headaches and sometimes also vertigo. We watch out also for insomnia. If you're on ginseng, you could have problems with sleep. And those are the three major ones that are out there that are fairly studied and fairly safe. But then again, if you want to use any of these, make sure you bring it to the attention of your doctor or your pharmacist so that they can check for interactions with your regular medications or disease states before you use them. There's one other one that is from an African tree bark called yohimbe, but that I didn't even want to mention it, but I know some of your viewers may know about it and they'll say, why didn't you say it? So I just have to make sure I bring it up. Yohimbe has a lot of side effects. As a matter of fact, the only time you use yohimbe is if you are on an antidepressant, maybe, some of the SSRIs, and that is causing your issues, your erectile dysfunction. That is when yohimbe is actually indicated. So if you're not on a medication that is causing ED, the yohimbe is out. And even if you're on a medication and you need to use ED, make sure, again, you talk to your doctor because it can cause heart palpitations, or, it can cause your heart to race. It can cause, rhythm problems, to heart rhythm problems, and you don't want to get that in yourself. It can also cause an anxiety in people who take this. So if you were asking me, I wouldn't suggest yohimbe at all, but I just want to make sure it's out there for people to know. Yes.
Okay. So that is also great that we have these supplements that we could use to help with ED. And as we mentioned, anxiety and depression, there's another one I want to throw in, ashwagandha root. It's also an adaptogenic that has also been seen to help with the anxiety kind of part if somebody has psychological issues. But as we said, with any supplement, you really want to talk to your doctor, even if it's natural. It doesn't matter what it is, especially somebody who is taking other medications, just to avoid the interactions and cause any issues. You might say this is natural. It doesn't matter, it's natural. It could cause interactions. Please talk to your doctor. Dr. Alton, that was really, really great. As we bring our conversation to a close, where could people find you? If someone is looking, I want to talk to Dr. Alton, maybe I have something going on.
Well, in the interest of privacy and stuff, I'm just going to leave you with my email and phone number. You can post on your in the
comment section.
Okay. Right. But if you want to follow my channel, as you said earlier, always on Day Spring Life and Health channel, as well as if for those who are Ghanaians, you can look out for Ghana Genac Health, Ghana Pomdin channel. And we have several disease state topics that we discuss all the time. And you can also contact me through there.
Great. And I'll say, what will be your last words for our viewers? Those who have watched this video till this time and like, okay, this and that. What would you say to them? Someone with ED.
Good. Thank you for the opportunity. And I want to say men out there, and as a matter of fact, women who are watching for their men, because, some women have to watch for their men. Yeah. What you have to know is ED is a disease that just like any other disease. And so if you have erectile dysfunction, you don't have to hide and keep it as a problem that nobody should hear about and go through problems, especially though for those who are married, and depression can lead to depression because of that. So what I would encourage you to do is seek help, talk to your doctor. Most of the doctors out there know they treat people all the time. And if you talk to your doctor, talk to your pharmacist, talk to your cardiologist, especially, and those who are diabetic, make sure you talk to your endocrinologist. Make sure that you seek help, because remember that if you don't solve that problem, you are not only having the problem to yourself, you're also giving another person a problem. And as much as they can contain the issue, it would be better off if you get the problem resolved. And there are several ways of treating ED, and there's no need to hide anymore like in the past where people never said anything about it. So please seek help, ask questions, talk to your nurse, your doctor, your pharmacist, or whoever you are comfortable with, and ensure that the problem is solved. And if you are going through any issues, we said that stress can also lead to ED, right? If for any reason stress is getting you there, make sure that you seek help, because it's better to do that than to let life be miserable just because of what you're going through.
Definitely. Great advice, Elder. So what I also want to say is that the women, please, if your man is going through this, support him. Don't kind of pull him down. Anytime that he tries, oh, you better Jenipa, please just give him the moral support so that as he seeks treatment, so that will bring happiness to the whole family. Well, thank you so much for watching this video. Please like this video, share it, and subscribe. Until we see you in the next video.
Beloved, I wish above all things that you prosper and be in health, even as your soul prospers. All right. So we have gone through the video, and I'm looking for any comments in this section. I don't see any comments, but obviously I have my contact information on there. You can always go back to look for it and then shoot me a question if you want it to be as private as possible. But I think it was a good discussion that we had, and hopefully you will share the video to people you know. Also, don't forget again to subscribe to the channel. Both channels, actually, the lady Salomey's channel is Ezra Wellness, where she talks about diet and a lot of stuff that would help you in your health, including fighting off diseases of every kind, chronic ailments. And we also have Day Spring Life and Health channel, where we're actually streaming from, and also another channel called Ghana Apomodin in the Twi language. All right, hopefully you check those out both on Facebook and also on YouTube, and we hopefully will get to you as soon as possible. Don't forget to get hold of us if you have any questions. If you want to contribute to the discussion, it's always a good thing to do, because we don't have every information. I'm pretty sure there are experts out there that are also watching that can contribute. So with this video being public, I hope to see more comments going and more viewership going forward. All right, thank you once again.